Hey guys, it's AG with nursingforall.com and Hurst Review Services, and today we're going to talk about the dreaded sequencing question. The National Council of State Boards of Nursing, also known as NCLEX-PN, they no longer administer just single option multiple choice questions on the NCLEX. Now, for several years, alternate format style questions have been included on the NCLEX exam. And guys, just mentioning alternate format often sends nursing students into orbit. Now at Hurst Review Services, we understand why that happens. Nursing students are more accustomed to single option multiple choice questions. However, alternate format style questions are not going anywhere anytime soon. Now, since these questions are here to stay, let's talk about how we deal with them the Hurst Review way. Now, if you know your nursing content like you're supposed to, it does not matter how NCLEX asks you a question. All right, so first, let's cover some facts about sequencing questions. Now, first of all, these questions are also known as drag and drop questions or ordered response. And the answers are going to be placed in a particular order as requested in the question. Now, some examples of this is highest to lowest priority, or steps in a process or a procedure. And all the options are used. And unfortunately, there is no partial credit. Now, let's try the tried and true methods of Hurst Review strategies when used to answer these kinds of questions. So first, we're going to carefully read the question. Make sure you understand what to do with the options that you are presented. Are you prioritizing options? Or are you providing the proper steps or sequence in a procedure? Then read all of the options carefully. If you are prioritizing, then decide what is the safest thing that you could do. Which option, if chosen first, would save a life? Remember Maslow's and your ABCs? You're going to use those here. If it's a sequencing question, then the steps in a process or a procedure, then remember what you learned about sterile technique, safety of client and the nurse, and universal precautions. All right, so let's practice a sequencing question here, and let's use the tried and true Hurst strategies that we just mentioned to help you answer this question. All right, here's your question. A female client has been prescribed an insertion of a urinary catheter. Now, after positioning and prepping the client, and after washing your hands, in what order should the nurse complete this procedure? Place the options in chronological order. All right, here are your options. Inflate the catheter balloon, remove and dispose of gloves, pour betadine over cotton balls. Using your non-dominant hand, separate and clean the labia using one swipe per cotton ball. Apply sterile gloves, and using the sterile dominant hand, insert the catheter 1 to 2 inches past where urine is noted in the urethra. All right, now with these options and with this question, you need to remember proper sterile technique and universal precautions. So, do you remember the proper way to put in a urinary catheter? Do you remember the steps? All right, yes, the correct order is 5, 3, 4, 6, 1, and 2. All right, the correct answer is 5. Apply sterile gloves. Then 3. Pour betadine over your cotton balls. Option 4 is next. Using your non-dominant hand, separate and clean the labia using one swipe per cotton ball. Next is 6. Using your sterile dominant hand, insert the catheter 1 to 2 inches past where urine is noted in the urethra. Next is 1, inflate the catheter balloon. And then last is 2, remove and dispose of your gloves. Did you get it right? Hey, great job. And guys, do you want more practice like this? Well, then make sure you tune in every Tuesday and Thursday for more Hurst Review strategies and NCLEX tips. And be sure to follow Hurst Review Services and me on all of your social media outlets. Have a great one, guys. Peace out, players.